HomeCare.com. I'm Alvin Washington.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. Happy Friday to our listening audience out there. It is June the 8th, 2018, and it is sweltering here in Scottsdale, Arizona, and we're coming at you live from the Scottsdale Air Park Studios for Money Radio, 1510 a.m., 105.3 FM, and the World Wide Web, moneyradio1510.com. So if you're just tuning in for the very, very first time, our show is called Health Futures for a reason, and the reason is that we are really talking about health care and the future of health care, specifically how our older adult population can live a healthier, happier life. And what makes our show special is the guests I bring to the show. I feel like I'm really just a facilitator. I throw out topics and discussion points, and we talk about the issues, the opportunities, the challenges that are faced with, or we are faced with our aging population. So today's no different. Today, we're going to break it up into a couple parts. The first half of the show, I am going to be speaking with the two people here in my studio, and they'll be here for the second half as well. So I'm going to introduce, right now, without further ado, our guests here in the studio. So just to my right is Lea Kahn. She is a healthcare and information services executive with significant experience in building and scaling businesses. And Ulya was on the show probably about 6 months ago, 5 months ago.
December.
There you go. You were on in December. You were working for a medium-sized company called Tivity Health that had a great a service. It's called Silver Sneakers. A lot of people know about that. And you and I met at an Aging 2.0 conference, and we're going to talk a little bit about that in a second. And to my left is Kim Bankifer, and Kim is somebody I've known for a number of years. She is not only experienced in the senior care world, but she is a relationship builder. She is presently a free agent, and we'll talk about a little bit about what Kim is doing right now. But more importantly, we're going to talk about the issues and the challenges that we are faced with. And there's a couple of topics that I want to talk about today, and we'll delve into them. I want to talk about the fact that this month is World Elder Abuse Awareness Month, and the actual day is Friday next week. So Friday, June 15th is the day, but we really take an opportunity for the month to really talk about World Elder Abuse. And a lot of people think it's just a physical abuse, but a big part of it is financial exploitation. Mm-hmm. The other thing is I want to talk about the longest day of the year. And for those that are caring for Alzheimer's patients and dementia patients, they know exactly what we're talking about, this being the longest day of the year. We'll talk about that. And in the second half of our show, we're going to have Dr. Rhonda Randall, and she is with United Healthcare. She is the Chief Medical Officer for their Retiree Solutions Division, and they just broke out with a report. It's the 2018 America's Healthcare Ranking Senior Report. So we're going to talk about that, and we're going to keep Ulya and Kim here around so that they can chime in and ask questions of Dr. Randall when she comes onto the show. So I'm going to pivot over here to you, Ulya, and beside you having this company called We Manage, and it's run by yourself and your husband, Tariq. you are also the ambassador for Aging 2.0 here in the Phoenix market, and you've taken over the reins for about 6 months now, and would love to have you. How long has it been?
It's since end of February, so March, April, May. It's the 4th month, yeah.
My math isn't so good. Yeah, it must be that new math. It could be the heat outside. But I want to talk a little bit about Aging 2.0, and I'm pivoting over to you to tell us a little bit about what's going on with Aging 2.0. And here in Phoenix, we've got some events coming up.
Correct. So I don't know what the audience know about Aging 2.0, but before I even cover that, thank you again for having me on the show, Bob. So Aging 2.0 for the audience is really, it's a platform and a movement that is passionate about changing the conversation around aging. Aging 1.0 was really, what was before, which was very medically focused and companies operating in silos, etc. Aging 2.0 is really all about inclusion, collaboration between private and public sectors, between for-profit and not-for-profit. And so very exciting time to be part of this movement. And of course, the big disruptor in the aging space, as far as I'm concerned, it started with Obamacare, really forcing companies and organizations to look at aging in a different way. So for Phoenix, the Phoenix chapter was actually a thriving chapter, and then I think there was some change of hands with ambassadors. And so I joined end of February as the ambassador for Aging 2.0, and what we have in the Phoenix chapter is some incredible companies joining this movement and this organization. Of course, with Cypress Health, Bob, you've been part of Aging 2.0, I think, since the beginning.
The very beginning, yeah.
But then we have other awesome companies, that are looking for either funding or growth in their sort of, next stage in their growth. And I was pleasantly surprised to see how much work there is happening on the startup side in Phoenix as it relates to aging, because this is where we have a lot of the aging population. So great place to be if you are at the aging business.
And you said startups, and you talked about innovation, and I want to remind you, and certainly our listening audience, we're coming at you live from the Money Radio studios, and the people that are listening here in today, whether it's themselves, their children, their acquaintances, neighbors, everybody's out there trying to figure out what the next best solution is. And aging is a space that we need as much assistance as possible.
Yes, and again, Aging 2.0 is really all about, we are very focused on making sure that we are able to provide solutions that would enable people to age in place and in community. And to make it sort of, make sure that everybody's rallying around the same things, Aging 2.0 has defined the 8 grand challenges of aging. So, Bob, if you have time, I can go through that now.
No, let's go through there's 8 of them, and go through them.
Yes, correct. So there are 8 challenges. The challenge number 1 around aging is engagement and purpose. And we all know that when people start to lose purpose, that often becomes the beginning of the end.
And if I can chime in, we've talked about it here on our show, is social isolation is one of the biggest challenges that we are dealing with in the community. And statistics have come out recently, and I think it was from the New England Journal of Medicine, is that being socially isolated is equivalent to smoking 15 cigarettes a day. Depression and other challenges happen as a result of people living alone. And 1/3 of our population, and I got this statistic from you, from the MIT Age Lab.
Yes.
And it shows that 1/3 of our population, 65 and older, is living home alone. And those numbers are a lot higher in certain geographies, like Washington, D.C. It's 48%. In Atlanta, Georgia, it's 45%. In San Francisco, it's 42%. In Minneapolis, what is
43%.
43%. So, I mean, think about it. Nearly half of our population in these major metropolitan areas, people are living home alone. So engagement and purpose is so
very, very important. And so challenge number 2 is around financial wellness, and very much aligned with Money Radio. And to what you were saying earlier, Bob, even smartest of people, as they age, for some reason they seem to become more gullible and vulnerable to these, scammers. There are just so many sad incidents where people lose their entire savings to these scammers that go in.
You want a stat?
I
got this right off the World Elder Abuse Awareness Day.
Yes.
So each year, an estimated 5 million older adults are abused, neglected, or exploited. Older Americans lose an estimated $2.6 billion, and that's with a B, or more annually due to financial exploitation.
Yeah.
$2.6 billion.
Yes, so financial wellness is up there in terms of the grand challenges. That's just, those are staggering.
They are staggering.
Yeah.
And just moving along, because I know we have less than a minute, we got mobility and movement.
Mobility and movement. We've got active daily living and lifestyle. We've got brain health, very important, caregiving, care coordination, and end of life.
And Aging 2.0 has made it their point we're talking about 8 grand challenges. So tackling 8 is a huge monumental task. So what they've decided is to focus in on 2 in 2018.
Correct. Yeah.
And that's caregiving, which is something we talk about all the time here on the show. And it's also brain health, which is something else we talk a lot about with dementias and Alzheimer's. And
exactly.
You and I got a chance to attend the Caregiver Forum.
Yes.
And I was very honored to be chosen to be a facilitator in that forum.
Yeah, you did a great job moderating, Bob.
Thank you. Well, it's hard to believe we got to end this first segment. Stick around. We got more to come with Lea Kahn and Kim Bankifor. You're listening to Health Futures, Taking Stock in You.
Gunderson's nationwide Best Stocks radio show is now on Money Radio 1510 AM and 105.3 FM. Every morning from 9 to 10 a.m., professional money manager Bill Gunderson will talk about the economy, markets, and the best stocks now. Bill Gunderson is also the inventor of the Best Stocks Now app and the writer of the weekly Best Stocks Now newsletter. If you like to invest in the markets, this is the show for you. You will not want to miss one episode. Visit GundersonCapital.com for more info. That's GundersonCapital.com.
Want to fly somewhere? Looking for cheap flights or cheap tickets? Then call. That's right. Call the low-cost airline travel hotline now for prices so low we can't publish them anywhere. Low-cost airlines has all kinds of cheap travel deals. Fly domestically and save up to 75%. You can even fly internationally and save even more. Yes, fly anywhere in the world and save a lot of money on your plane tickets. We'll even save you money with cheap travel deals on hotels, rental cars, even complete travel packages. So don't book your tickets until you call us first for the absolute cheapest prices on U.S. and international airline tickets and hotels. Call right now for prices so low they can't be published. Travel experts are here 24/7 to help. 800-611-7394. 800-611-7394. 800-611-7394. That's 800-611-7394.
The following update is for drivers who pay too much for car insurance due to DUIs, DWIs, tickets, or anything else. Our company specializes in low-cost SR22 auto insurance. We know that mistakes happen and offer free quotes for very affordable auto insurance meant specifically for you, the overpaying high-risk driver. The quote is free, and we'll handle the filing so you can start saving money. Call 800-749-2984. 800-749-2984. 800-749-2984.
New to Bitcoin? Now up over 3,000%. Expert reveals new digital currency bigger than Bitcoin for under $1. Call 203-800-3333.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're on our second segment. And I've got Lea Kahn and I got Kim Bankifor here in our studio. And we're talking about Aging 2.0. And we're talking about a lot of other things. We're talking about World Elder Abuse Month, and actually World Elder Abuse Day is next Friday. And we're also talking about the longest day of the year, which is coming up on the summer solstice, which is June 22nd, 21st. I think it's 22nd. And we're talking about Aging 2.0. So, Ulya, we were talking about the grand challenges. So we went through each of the grand challenges. We ended up talking about the caregiver symposium that you and I attended, and I got to moderate one of the sessions. And then we got a brain health one coming up in August, and Michelle Cornelius, who is running our dementia program, is going to be attending that in Toronto, and I understand that you're going to attend as well.
Yeah, I have changed my travel plans to actually be there on August 7th. It's going to be a very important one.
You know, we really need to help come up with solutions. I mean, we know the stats are daunting. I mean, we know that 10,000 people a day are turning 65. We know that's 3.6 million a year, and we know that from 2000 to 2016, the number of Americans that were 60 and over jumped 50% to 69 million. By 2020, the older population will be about 77 million, and then by 2040, it's going to go to 102 million. So, I mean, we are aging at such a rapid rate. We need innovation. We need tech. And I really believe Aging 2.0 has created themselves to be a platform or curator for this.
Exactly. So they've created a platform and what I call a movement. So taking a step back, Bob, you actually, shared with us some staggering data and statistics. But when you take a step back, there is more happening. So declining birth rates. That means declining caregiver population as we move forward. So you have a scenario building up with the silver tsunami coming our way, and we have people turning 65 every single day, those who have turned 65 living longer and longer thanks to medical advancements. Children who are 10 today have a 50% probability of living to be 104 years old.
Do you hear that?
Yes.
If you have a 10-year-old, 104.
104 wow. In the U.S. and 107 in Japan.
Wow.
So the longevity piece, it comes at a price. And really, that's why we need to be solving for it now. How does one stay healthy? And health is not just physical, because you can have the best body in the world. But when the brain goes, a lot of people tell me the soul goes. So brain health is very important, and hence the focus for 2018 very much being on brain health and caregiving.
It's so important, and engagement, and for me, you hit the nail on the head, and something I've talked about is the fact that we are having a shortage of workforce, and that is why some of these innovations that you and I have seen, and Kim, you've seen in the communities you've been in, enhance the care that's being given. Now, we know robots aren't going to replace humans. We know that we can't replace one-on-one human contact, but we do know a couple things. We know that people want to age in place. 92% of those polled want to stay at home.
Yep.
We do know that it's the least costly place for care to happen, because when you compare the cost to independent living, assisted living, or a skilled nursing facility, all of those are very pricey and very expensive. And we know that if we can adapt that home with some of these new innovations that you and I have seen, and that are some of the stuff that has not even been created yet, is going to solve this aging crisis.
Yeah, so
caregiving crisis too.
Yes, I mean you bring up some great points, Bob. So the way I look at aging, technology is there to augment and to help, not to replace the human touch. I mean, I was talking to the CEO of one home care business who actually in New York, and he shared with me that one of his clients was actually ending up in emergency rooms 30 times a month.
Wow.
Not because there was anything wrong with him, but because he was craving human touch.
Lovely.
And by providing a caregiver at home, that number fell down to 2. Now, it's still too many.
Too many, yeah.
But just imagine what that does to the, to the provider's bills as well, health plans bills. So this is a problem that technology can certainly aid and help with, but not replacing the human touch. The other thing that technology allows us to do, especially in the caregiving space, is, provide for scalability. And when we talk about people living at home, we have the technologies that really would allow us to really go one step forward to that fully connected home, where research shows that by 2022 there will be 500 plus connected devices in any individual's homes. We already have many trials running where people have not just cameras in common spaces, but also sensors in refrigerators, sensors in beds and bed sheets that basically show when somebody lies down, did they have a restful sleep? Sensors that basically say, hey, mother did not show up in the kitchen between 8:30 to 9:30, which is her window. Hey, dad did not open the refrigerator. He hasn't opened for the last 4 hours. Maybe he's not hydrating properly. Maybe he's not eating. So so technology can be a great enabler in allowing people to age in place and in community.
Agreed. Absolutely. And Kim, I imagine you've seen some of this in the community setting with technology.
Well, it's interesting because I had the blessing of working in one of the most high-end luxury senior communities, and although we filled some of the needs of the residents, what you're speaking to with the interaction, socialization, and one of my goals and one of my objectives was creating the lifelong learning experience, making sure technology was enhancing their lifestyle. One of the pilot programs we did that was so fascinating was a private setting at the Apple Store here in Scottsdale. And that sounds silly, but to tell the regional marketing team, I think you're ignoring a big segment of the population. And when they asked me what ages, and I said primarily 80 and above, they looked at me like I was crazy. And yet when we brought a bus full of our residents to interact with their team and their staff, once we had the proper screens, the proper microphones, they were absolutely blown away with the aptitude of our residents and their willingness to learn in the right environment. So yes, I mean, enhancing seniors' lifestyles, it doesn't matter whether it's on the extreme luxury end of senior living or in the home. Many of the new developments, many of the new technologies are important really at any demographic or income level.
Well, it's interesting you mentioned Apple Store. So at the caregiver forum that Ulya and I attended, Best Buy was there. And I had a colleague of mine that I worked with at Gatorade many, many years ago that was the chief marketing officer. So when the gentleman got up and spoke, because he was one of the sponsors, I asked him to sit down next to me. So we had a conversation. So I caught up with my buddy, and then I said, so tell me, why are you here? I said, is it because of the fact that Apple has the Genius Bar and you're thinking about, because I knew what you had done at that high-end community that has the Genius Bar, and you thought that maybe you could bring people, older adults, into the store?
Well, it was a win-win because they also had the capability of buying the high-end products and doing FaceTime on an Apple TV and using these technologies to interact with their family members, their grandkids. So it was a great setup.
So you want to hear what his response was?
What?
It's not for them to come into the store. He goes, we have over 12,000 geeks that ride around in Geek Squad cars. He says, do you realize that over 90% are 65 and older? And I was like, did not know that. Well, we're up against a break. It's halftime here at Health Futures. Stick around. We got a robust second half. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 AM and 105.3 FM.
New charges have been filed against a former top Trump campaign official and a longtime associate. Correspondent Evan Perez says today's action comes on top of accusations of witness tampering.
Prosecutors earlier this week alleged that Paul Manafort was attempting to reach out to witnesses and coach them and perhaps getting them to commit perjury in their testimony to the special counsel. Instead, what we've seen is the special counsel bringing new charges against Paul Manafort.
Chef and TV host Anthony Bourdain is dead at age 61 of an apparent suicide. Correspondent Alex Marquardt.
Bourdain started working in kitchens at a young age and would become a celebrity chef and author as he made his way into television. The Smithsonian called him the original rock star of the culinary world, the Elvis of bad boy chefs.
On Wall Street, the Dow Jones Industrial Average up 54 points, the S&P 500 gaining 7, the Nasdaq up 13. I'm Ann Cates.
Grainger stands for safety, and they know what safety stands for. S, safety. A, all about safety. F, feeling good about safety. E, extreme safety. T, talking about safety. Y, you guessed it, safety. First aid kits, eye wash stations, fire protection, you name it. For over 90 years, they've been helping to keep facilities safe and people safer. When it comes to safety, Grainger's got your BACK. Call or click Grainger.com to see for yourself. Grainger, for the ones who get it done.
If you or someone you know is struggling with addiction, please call this toll-free number right now, 800-390-9528. That's 800-390-9528. By calling your addiction team, you're taking the first steps to recovery. The help you need could be one call away. 800-390-9528. Make the free call now. 800-390-9528. Your addiction team is a third-party advertiser for various treatment centers and placement networks. Individual results will vary. Visit youraddictionteam.com/terms for more information.
Money Radio, a pioneer in a broadcasting format, giving people confidence in their finances before and during retirement. Welcome to the club.
Bill Gunderson's Nationwide Best Stocks radio show is now on Money Radio 1510 AM and 105.3 FM. Every morning from 9 to 10 a.m., professional money manager Bill Gunderson will talk about the economy, markets, and the best stocks now. Bill Gunderson is also the inventor of the Best Stocks Now app and the writer of the weekly Best Stocks Now newsletter. If you like to invest in the markets, this is the show for you. You will not want to miss one episode. Visit GundersonCapital.com for more info. That's GundersonCapital.com.
Tired of paying outrageous prices for Viagra? Well, we have great news for you. Now you can finally get Viagra at huge discounts. Healthy Man allows you to save up to $500 on Viagra. Why pay U.S. pharmacy prices of $15 per pill or more when you can get Viagra for less than $3 a pill? Call today and get 40 Viagra pills for only $99. This can cost as much as $600 at your local pharmacy. You can't afford not to call us. If you want Viagra at the lowest prices, never pay $15 a pill pharmacy prices again. Get Viagra for less than $3 a pill. Call 1-800-865-0116 today and save up to $500 and get 40 pills for just $99. Healthy Man is fast, easy, and affordable. Operators are waiting at 1-800-865-0116 to take your call now. Call 1-800-865-0116. That's 1-800-865-0116. Again, 1-800-865-0116.
This is David Kogan with Eliances, ELIANCES.com. Unlock the secrets to Richard Branson, founder who we interviewed, Big Lots CEO, president of Telemundo, founder of North Face, Chuck E. Cheese founder, and hundreds more. Every Monday at noon and Saturday at 7 a.m. on Money Radio. Go to Eliances.com, ELIANCES.com to unlock the secrets of some of the most successful people in the world. Eliances.com.
Wow, Bitcoin up 3,100%. Expert reveals for the first time 5 cryptocurrencies that can even overtake Bitcoin. Call 203-800-3333.
Bruce Vail with Your Money Now. Korean automaker Kia Motors is recalling more than 500,000 vehicles in the U.S. to fix a flaw that may prevent airbags from deploying in a crash. The recall is linked to a federal investigation into 4 fatalities and 6 injuries in Kia and Hyundai vehicles from airbags that failed to deploy in accidents. The recall affects certain Forte, Optima, and Sedona vehicles ranging from the 2010 to the 2013 model years. President Trump today called for Russia to be let back into the group of 7 industrialized nations, 4 years after the country was expelled over its annexation of Crimea. Mr. Trump made his comments as he departed for the G7 summit in Quebec. On Wall Street, stocks are holding on to small gains, with the Dow Jones Industrial Average up 46 points. The Nasdaq Composite is ahead 8 points, and the S&P 500 is up 5. That's Your Money Now.
What happened? You used to go hours without visiting the bathroom. Now it seems like you're constantly getting up to pee, and you're even getting up at night to go. This is not okay. Listen, the makers of Super Beta Prostate, the #1 prostate formula, are introducing a new wonder pill, Super Beta Prostate P3 Advanced, with 3 key ingredients that are great for your prostate. It's like taking 3 prostate supplements in one. To celebrate, we're sending free bottles to men who want to cut down on bathroom trips. Yes, your first 30-day supply is free. Pay shipping and handling. Call 1-800-215-1792. Early research suggests that an ingredient in P3 Advanced may help support a normal prostate size. Combine that with a reduction in urges to pee, and you have a formula you'd be crazy not to try. Get P3 Advanced free. Call 1-800-215-1792. 1-800-215-1792. 1-800-215-1792.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. We're here in our second half, coming right at you live from the Scottsdale Air Park, and it is Friday, June the 8th. And the first half of the show, if you missed it, you can find it up on cypresshomecare.com. Click on the media button, hit the drop down, and the third button down is radio show. And you can find about 200 of them there, but look for today's, June 8th, and you'll catch those first 2 segments that you may have missed. And in those first 2 segments, I had Lea Kahn and Kim Bankifer here on the show. We talked about Aging 2.0. We also talked a little bit about World Elder Abuse Month, and World Elder Abuse Day is actually next Friday. And we also talked about the longest day, which is June the 21st. And it's a challenging day for those that are afflicted, those families that are dealing with Alzheimer's and dementia. So the second half of the show, I'm pleased to announce that I've got a guest on the phone, and I want to introduce her and say hello to her because I haven't had a chance to say hello to her. I've got Dr. Rhonda Randall. She is the Chief Medical Officer for United Healthcare Retiree Solutions. Welcome to the show, Dr. Randall. Are you there? We may have lost her. All right.
I'm here. Thank you, Bob.
There you go. Hey, how are you?
I'm very well. Thank you for having the opportunity for us to speak with you and your audience today.
So, can I call you Rhonda?
Certainly.
Okay, perfect. So, Rhonda, I have here in the studio, I've got Lea Kahn and I got Kim Bankifer, and the three of us are looking at the 2018 America's Health Ranking Seniors Report. And I appreciate you coming onto the show to really talk about this report because according to this report, seniors in Arizona ranked 31st in overall health. And in 2017, we were 23rd. So that's not a good thing, is it?
You know, there are, with every state in this ranking, it is that. It's a ranking. So we're looking at how states are doing in relativity to one another. And every state has its areas of strength. Each state has its areas where it's most challenged. Concerning for Arizona is when we started to do a senior-focused report in 2013, Arizona was ranked 18th. This year, it's ranked 31st. And often when a state goes down in rankings, it's generally a combination of two things. There may be areas that other states are improving at a faster rate than Arizona is, and there may be areas where Arizona is going in the wrong direction with our health.
Well, you know, the one piece that I do want to talk about, and if you don't mind, I want to just jump right on it because this week has been a devastating week as it relates to suicides. And, you know, we all heard about Kate Spade earlier in the week, and now Anthony Bourdain is now gone. Can you talk to us about what's going on? I mean, this is now, and I think I heard the report the other day, it's the 10th leading cause of death. Suicides?
Yeah, I'm glad you asked that question. It's concerning for us in the senior report from America's Health Rankings published by the United Health Foundation as well. One of the things that we've noticed is that suicides have increased nationally for seniors by 12% across the nation since 2014. Something that we really need to pay attention to. And when well-known individuals take their own lives, it brings the conversation to the forefront. So it's important that we talk about that all the time and recognize things that correlate, how we can reach out to individuals who need help, what might be letting us know that individuals are at risk for depression and suicide, for example. So I'm glad you asked that question. And in the state of Arizona in particular, we're seeing that the trend for suicide is even more significant in Arizona than it is for seniors in the overall United States. We see 16.6 suicides for every 100,000 people over the age of 65 in our nation. In Arizona, that jumps to 24.4 suicides for every 100,000 people over the age of 65. So this is a troubling trend.
It is, and I believe, and we talked about this in either our first or second segment, the social isolation piece. We were talking about that with Aging 2.0.
Yeah, and so Rhonda, hi, this is Ulya. So do you have any more insights into these numbers, especially as they relate to Arizona? Because obviously, one thing's in the Sunshine State, the depression, when you have dark clouds and gray, weather, cold weather, you're more prone to suffering from, depression and all that other stuff. So where you have sunshine, great weather, opportunities to go outdoors, why is the rate so high for Arizona?
It's a great question. And this report doesn't tell us with these 34 different measures of our health what the cause and effects, but we can certainly see that there are measures that are closely related. In other words, we can see correlations, but doesn't necessarily tell us the cause. So when we look at suicide among seniors nationally, we do know some information, and this information in our report comes from the CDC. It comes from the National Vital Statistics System. So it's the data that a coroner or medical examiner would be entering on someone's death certificate. So it's not telling us more detail around the method of suicide, for example, or the cause prior to that. But we know there's a strong correlation between people who are not getting care for mental or physical health programs. Social connectedness is very important. I'm glad you talked about isolation earlier. We do have some data in that on our report as well. The ability to cope and adapt to change, and bringing up this concern around seasonal affective disorder, if you will, how much daylight or sunlight we're getting. Interestingly, when you look at suicide across the nation, the states that have the lowest suicide rate among seniors are in the northern part of our country, for example. And the states that have the highest rate of suicide among seniors have a tendency to be in the western United States.
And Rhonda, that's again very interesting facts. And do you think it might be skewed a little bit because obviously the more senior populations reside in Arizona, Florida, Texas, rather than in those other northern states? Could that be a reason?
So the data is adjusted for the population size. So it looks at the number of deaths caused by self-harm for every 100,000 adults. So it would normalize for, particularly states that have larger populations over the age of 65. We know there is a really strong correlation, of course, with depression. One of the other measures in this report is frequent mental distress. So that's a survey asking seniors if they feel that they have mental distress 14 or more days a month. We also know there's a strong correlation with having chronic medical conditions. So physical health can also have a very strong correlation with the suicide rate. And then, of course, there are other things like excessive drinking, et cetera, that we look at. And then there's some things that we notice that are protective. Volunteerism is a really good example of that. So we use that measure in our report to look at how active seniors are in their community after their retirement. Of course, there are other things that we can't measure everything, but volunteerism is a really nice proxy for that. And we have a tendency to see the states that have the highest rate of seniors volunteering also have lower rates of senior suicide.
Rhonda, this is Kim. I wanted to ask you, was there any, in the data, was there any discussion about, and this has always been fascinating to me, and I've always worked in an environment where we encouraged seniors to continue working as long as possible. How does work and or career, where possible, affect this data with suicide?
So with many measures in our report, one of the things that's wonderful about our website, it's americashealthrankings.org, we can take many of these determinants of health and break them down by different cohorts. So we can see if there's a difference between seniors who live in a rural community versus an urban setting. We can see if there's a difference in gender or ethnicity, those who have achieved higher levels of education or certain income bands. And the piece around suicide is an important one to look in that area. One of the things that we've noticed in this report nationally is seniors who live in rural areas are facing more health challenges than seniors who live in urban settings, for example. And although we don't have the data on suicide, there are many things that correlate. More seniors who live in rural areas are less likely to be physically active than their counterparts who live in a city. They're less likely to rate their own health as very good or excellent. They're less likely to get their health screenings or a flu shot. They're more likely to report a fall. So we know there's some significant disparities between seniors who live in rural communities versus those who live in urban communities, for example. And many of those measures and determinants of health we can break down in that manner.
You know, I really appreciate you bringing up the rural communities versus the urban communities. And certainly, you know, from a caregiving standpoint, you know, Rhonda, my family and I own an agency has been providing care here in the Phoenix metropolitan area. We're in our 25th year. And I will tell you, it's hard to get out to those rural areas. And everyone thinks of Arizona as Phoenix, but, you know, 95% of Arizona is very rural. And, you know, you look at Navajo County and you look at, you know, Pinal. I mean, it's hard to get to these places. And I'm not asking you if you have the solution, but the hardest thing is aging in a rural area and being able to supply providers and other medical, you know, supplies, if you would, for lack of a better word, is challenging for us.
Mm-hmm. Yeah. Well, you know, and in Arizona, even though you have that challenge, and you're ranked in the middle of the pack for the U.S., those are some areas that it appears that you have done very well considering those challenges. So let me give you some data points in that regard. So we look at long-term care broadly, right, starting with nursing home quality. Arizona is ranked very well in regard to nursing home quality, 10th in the nation. That means that if you do need to be in a nursing facility, that you have greater access to a 4- or 5-star nursing home bed. We also look at things like home and community-based services. So are individuals having good access to home health workers? Are they getting access to home-delivered meals, for example? Are they having a risk of falling? And then for those who are in a nursing home, are we avoiding putting people in a nursing home when they only need a little bit of assistance and could get support in their community from other types of caregiving, home health aides, et cetera?
You know, it's nice to know that we are doing...
And in many of those measures, Arizona's done well.
Yeah, it's nice to know that we are doing well in some of those measures. You probably hear the music, so we're getting ready to wind down our third segment. But I will say this, one of the stats that you did share with us is hospital readmissions decreased 9% in the last 4 years. And being part of the healthcare continuum, this has been something that we've worked really hard to do. And I want to pick up on that a little bit more in the fourth segment. You've been listening to Health Futures, Taking Stock in You. I've got Dr. Rhonda Randall on the phone, and I've got Lea Kahn and Kim Bankenford. We'll be right back.
Financial market analysis from Market Wrap host Mo Ansari.
Diversification is the key. You have to have diversification in these markets. And if you have all your eggs in one basket, when things go bad, you're going to get hurt.
It's financial food for thought on your drive home. Market Wrap with Mo Ansari.
Catch Market Wrap on Money Radio 1510 and 105.3 FM Monday through Friday at 5 p.m.
Warning, don't let your business get left behind in what is likely to be the biggest economic boom in recent history. If you need to build for your business to grow, call General Steel today for a pre-engineered steel building designed for your needs. No wasted space. Steel prices are expected to rise, but you can still lock in your price on a General Steel building. And you can still save as much as half the cost and time of conventional construction. As much as half. But you must call now. If you need a church building, office, warehouse, manufacturing space, retail space, or more, call General Steel today. You can still get the General's 50-year structural warranty and General Steel quality, all at a price you can afford. So don't let rising steel prices put your project out of reach and stop you from making your company great.
800-965-1293. 800-965-1293. 800-965-1293. That's 800-965-1293.
My mom's a breast cancer survivor. The United Breast Cancer Foundation saved her life, and they need your help so they can continue saving more women's lives. Help them by donating your car. They'll provide fast, free 24-hour pickup, and you receive a charitable tax deduction. They take cars, trucks, vans, and SUVs, running or not. Call 24 hours a day, 800-475-6040. Your donation could literally save women's lives. Call today, 800-475-6040. 800-475-6040.
Have you written a book? Learn how to get it published and potentially sold online at bookstores. Call Page Publishing now for your free book publishing kit. 800-470-4833.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I'm very privileged to have on the line with us Dr. Rhonda Randall. And Dr. Rhonda Randall is the Chief Medical Officer with United Healthcare Retiree Solutions. And I've also got in the studio Lea Kahn and Kim Bankenfer. And we were just talking about, I feel like this is like The View. You know, I come at it from a perspective of caregiving and delivering care into the home. You know, Ulya is more from the healthcare business, innovation, startup, solution type perspective. And Kim is from the community setting, senior living, high end. And you, of course, Rhonda, are giving us some incredible data and some data points that really help us from a benchmarking standpoint and really help us realize how is Arizona doing, how are we scoring relative to others. And when we broke from the last segment, the third segment, I said that, you know, and you were talking about some of the things that Arizona was doing really well in. I talked about hospital readmissions, how we work really hard, you know, not to have older adults come back into the hospitals. And we're down 9% versus 4 years ago. So how is that versus other states? And Rhonda, I'm going to turn it back over to you and ask my View partners here to chime in as well.
Thank you, Bob. Well, that's really great news, isn't it, that hospital readmissions are down. In fact, over the last 5 years that we've been looking at it, down 32%. In addition to what you mentioned earlier. So when we started doing this report in 2013, 15.6% of people who had been in the hospital would go back within 30 days in the state of Arizona. And now in 2018, it's 14.2%. So that's a nice decrease. That trend has followed similarly to what has happened across the United States, but Arizona is doing better than the national average. You're lower than the national average on hospital readmissions, and that's really important. You know, some readmissions for seniors who have very significant chronic conditions are not avoidable, but many readmissions are avoidable. And, you know, from a personal standpoint, the turmoil that it causes for a senior and their family and caregiver to have to go back to the hospital within a month for something that was related to the reason they were there last month and potentially preventable. That's an important quality measure that we take a look at. So we're happy to see this national trend continue, and particularly in Arizona.
I love it. Absolutely love it. I really, love hearing, because I love the state of Arizona and what we're doing, that we are scoring well in some areas. When we started the third segment, we talked about some of the things we aren't doing very well in. I'm looking to you in terms of, what are some tips that you can offer our listening audience to, especially with seniors, to attain better health and well-being so that we can continue to score really well in these numbers?
Well, first of all, keep doing well in the areas that you already are. Don't take your eye off the ball on those. Here's a couple other good examples in addition to the ones that we've talked about. Number one in the nation for the use of hospice care for somebody who has a terminal illness.
Number one.
That's really important.
Wow.
Number one. From survey data outside of this report, seniors overwhelmingly say, if I have a terminal condition, something that cannot be cured, rather be cared for in my home. And when we see high hospice use and decreasing hospital readmissions, for example, that gives us an indication that more seniors are getting the kind of care that they want. So that's a good thing. As far as the challenges are concerned, we look at these measures in groupings. The first is what's within our control of our own health as individuals. Things like, are we physically active? Did we quit smoking if we were a smoker? Are we overweight? Are we excessively drinking? And so for the seniors listening, I would say, what within your own control can you modify and maybe just make some small changes? That physical activity is so important as we age to maintain your independence. So find something that you love doing, gardening, taking a walk with a friend or the dog, whatever that physical activity is that can keep you mobile. Tai Chi, yoga, it's great for your health. The second is for our communities. How can we support each other in those communities? There's both formal and informal ways to do that. We talked about volunteering, but it might just be, if you're somebody who already is that physically active person, to knock on your neighbor's door and say, hey, I take a walk in the morning. Would you like to join me? And there's a lot we can do to help each other in our communities. From a public policy standpoint, we have a tendency to think with healthcare that the politicians that are going to solve it for us, they are an important part of the equation. And there I would say a couple things to look at are there's not enough seniors in Arizona getting their flu shot. And that's so important because we know that it causes unnecessary hospitalizations.
We have to end the show. I can't believe it.
I'm sorry about that.
That's okay. I've enjoyed having you on the show. Lea Kahn, thank you. Dr. Rhonda Randall and Kim Bankeford.
Thank you, Bob.
Make it a great day. We'll see you next Friday.
Have a wonderful weekend, everyone. Bye-bye.
Thank you.
Have questions about your own or your loved one's future health care? Call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
Bill Gunderson's nationwide Best Stocks radio show is now on Money Radio 1510 AM and 105.3 FM. Every morning from 9 to 10 a.m., professional money manager Bill Gunderson will talk about the economy, markets, and the best stocks now. Bill Gunderson is also the inventor of the Best Stocks Now app and the writer of the weekly Best Stocks Now newsletter. If you like to invest in the markets, this is the show for you. You will not want to miss one episode. Visit GundersonCapital.com for more info. That's GundersonCapital.com.
Money Radio 1510
and 105.3 FM.
KFNN Mesa, Phoenix, and K287BX Mesa. You're listening to the Valley's only source for full-time financial news and money talk on the radio, Money Radio. Let's take a look at the market. Dow up 80 points at 25,321. S&P up 9 points at 2779. And NASDAQ up 11 at 7646.
When people want to talk about money, this is the place they come to. And there's more on the way after this break for the latest news. And we begin